Hi, my name is Erin Strife. I'm the Director of Healthcare Services for the Clinton County Health Department. I'm going to start with our numbers for today. We currently are still at 56 confirmed, lab-confirmed cases. We have not received any additional case reports today. We are at still the 3 probable cases. There are 3 case categories, again, just to review: confirmed, probable, and suspect. And we're at 42 suspect cases. We have, sadly, 3 cases, both confirmed and probable, but 3 total, who have passed away. 79 cases have recovered. So out of the 101 total cases that we are aware of, 19 of them are currently active cases who continue to be followed. I do want to just mention, as many of you are aware, the New York State Department of Health did antibody testing unexpectedly over the weekend. They started Sunday afternoon and they finished up on Monday, I believe in the morning / during the day. We do not immediately know the results of that. We need the state to share those results with us, but as soon as we get any information about what conclusions they may have been able to draw on from that random sample, we will absolutely be sharing that out with everybody. I do want to emphasize the reason that the state chose not to let anyone know ahead of time, including the local health departments, was because they felt it would better enable them to get a truly random sample of people. So that was a state decision. That was their rationale behind making that decision, and we are still pending the results of those samples that they were able to take. And next on the list, I do just want to mention the masks. I've seen a lot of people wearing the masks out and about. That's really great. There have been a few reports of mask use that has been maybe a little bit less than helpful, so I'm going to just one more time go through the mask. And we did get, this is my employer issued mask here. We got some cloth masks that we wear to protect others. Again, just a reminder, we're wearing these so that we're not sharing our droplets with other people when we're close to them. But this does not replace the physical distancing. We still need to stay 6 feet away from each other, and we still need to wash our hands and use good hygiene measures and everything else that we've been doing. I want to keep emphasizing that. And so again, before putting a mask on, my hands are recently washed, but you're going to want to wash your hands before and then after. So hands washed, put the mask on. This one has some nice pleats that allow it to really fit well around the nose. So it's up over the nose, down over the chin, and then it fits fairly snugly against the side of my face here. There is a little bit of a challenge with the glasses fogging up. Some people may have experienced this. If you're able to tuck the fabric up and rest your glasses on top, that helps prevent the fog that some people get. So a couple of don'ts: make sure that the mask is covering well over your nose. This is not how to wear it. Same with this, has to go over the chin. So top of the nose, all the way under the chin, and fits fairly snugly on both sides of the face. So another thing that I have noticed is people will take the mask down to talk or just wear it kind of like this. This is not very useful for anybody. But another really important consideration is we don't want to touch the mask a lot, because that's like touching our face. We're trying to avoid giving ourselves the virus, and the more we're touching, the more likely we are to be inoculating ourselves with viral particles, especially if we're out and about and touching other surfaces that might have virus on them and then bringing our hands to our face. So again, you're going to wash your hands, take your mask off, and then the mask can be washed. It should really be washed at least once a day, if not after each use, ideally. And you can put it in the dryer, or if you're afraid it will shrink, you can also air dry it. And I admit I ironed mine this morning to help keep the pleats nice. So that's a little bit about mask wearing. It was going to be a brief one today, but I just want to say also, we're doing, I think, well, all working together to try to stop the spread of the virus, and it seems just based on the numbers the past few days, like the spread seems to be slowing. Again, we could use more testing, of course, but I think we're going to look at, over the next few days, being able to test a few additional people, hopefully. Again, we don't have the numbers to test the entire county. We have a big county, but hopefully through the federal and the state government, we're going to see an increase in testing capacity, and that's going to support our ability to start going back to work and start doing some of the other things that we've been probably pretty anxiously awaiting, such as seeing family members and friends and all of that sort of thing. So we're doing okay, cautiously optimistic, but let's not risk any gains that we've made. And we need to remember to not let our guard down, because the virus could come back and that would endanger our entire society. Keep up the good work. Thank you.